Hello everyone and welcome back to my physiology playlist, and today we will deal with chapter number 71 of unit 13, and this chapter talks about the physiological aspects associated with liver physiology. Okay, so obviously you first have to understand and read and go through my lectures जिसमें हमने liver की anatomy की है, and then very important is to also understand the histology of the liver, because without doing those things it will be very difficult for you to understand the physiology. So my strong recommendation would be that you go and watch those videos first, the anatomy of liver and the histology of liver. What I can do is I can give the link in the description of this video ताकि वो videos भी आप जाके देख लें. Okay, so इस chapter में we will be dealing with the physiological aspects of liver functioning. Although liver is a discrete organ, यानी एक अलग से organ है, but it performs many different interrelating functions. So it's just like a factory जो आपके body के different areas के बीच में coordinator के तौर पे काम करता है. The critical interrelated function of the liver become especially evident when abnormalities of the liver occur. This chapter summarizes some major functions, including the following. Number one, filtration and storage of blood. Now, many people think that only kidneys can filter the blood. You will have a look at how liver is also involved in filtration in a different context, but filtration happens in the liver. Metabolism of carbohydrate, protein, fats, hormones, and foreign chemicals. So, metabolic factory है liver obviously. Formation of bile, very important function. Storage of vitamins and iron, and formation of coagulation factor. So liver produces a lot of different proteins, and coagulation factors are amongst the very important ones of those. Okay, so these are the major functions जिस पर हम touch करेंगे इस chapter में. Although these are not the only function. Liver is such a versatile factory. It stores glycogen, and it does a lot of different things. Physiological anatomy, very quickly let's review the anatomy. Liver is the largest organ in the body. Now, okay, some people argue skin is the largest organ. It depends upon how you're looking at it, but liver remains the largest organ as far as any metabolic organ is concerned. It contributes about 2% of the total body weight. It's a huge percentage for weight by a single organ. And if we talk in terms of kilograms, it's about 1.5 kilograms in an average adult human being. The basic functional unit of the liver is known as a lobule. जैसे kidneys में nephrons हैं, and then यहाँ पर जो hepatocytes हैं वो एक particular shape बना देते हैं, which is then known as the liver lobule, which is a cylindrical structure several millimeters in length and 0.8 to 2 millimeters in diameter. Exact lengths आपको याद रखना ज़रूरी नहीं है, बट ये पता होना चाहिए कि each liver is composed of these small units. तकरीबन 50,000 से 1 लाख के करीब units होते हैं, and these are called liver lobules. The liver lobule shown in cutaway in the figure 17.1. अभी हम इस diagram में देखेंगे. So that's the diagram's basic structure of a liver lobule. So it is constructed around a central vein that empties into the hepatic vein and then into the vena cava. So if you look at the diagram here, there is a central vein and the lobule is constructed around it, okay, and then there is a flow which is then telling you that we have a portal vein and the bile duct and the hepatic artery towards the periphery, and then there are some sinusoids between the cells. So here we have the liver cell palette. These are the cells of the liver, the hepatocytes, and here we have the sinusoids, the gaps, and the blood is flowing from the central vein through the sinusoids into the portal vein. So this is the central architecture. The whole lobule is constructed around a central vein that empties into the hepatic veins and into the vena cava. The lobule is also composed principally of a lot of cells, hepatocytes, in the form of cellular plates that radiate from the central vein like a spoke in a wheel. ये भी जो हमने diagram देखी थी, you see. So these are the central plates which are made up of hepatocytes. Each hepatic plate is usually 2 cell thick, and between the adjacent cell lie a small bile canaliculi that empties into the bile duct in the fibrous septa. So यहाँ पे basically ये जो liver cells हैं उसके बीच में ये little duct is the bile canaliculi, which ultimately goes into the bile duct. So ये liver cells will produce bile, and the bile will follow this direction. Okay, ultimately it will drain into the bile duct. In the septa are the small portal venules that receive their blood mainly from the venous outflow of the GI tract via the portal vein. From these venules, blood flows into the flat branching hepatic sinusoids. So there are portal venules जिसमें से GI tract का blood आ रहा है. Okay, Hepatic arterioles are also present in the interlobular septa. Here, two lobules के बीच में hepatic arterioles are present. Okay, so remember this is one lobule. There will be another lobule. There will be another lobule. So there are multiple lobules. And हम जब interlobular कहते हैं तो मतलब दो lobule के बीच में जो septa है. So hepatic arterioles are also present in the interlobular septa. These arterioles supply arterial blood to the septal tissue between the adjacent lobules. Obviously, it gives liver, like other organs, also need oxygenated blood. So it gets oxygenated blood via the hepatic arterioles. It gets blood from the GI tract via the portal venules. Okay. In addition to the hepatic cells, the venous sinusoids are also lined by a few other cells, typical endothelial cells, large Kupffer cells, which are part of the immune system, and they are actually the resident macrophages. वो macrophages जो liver में settle हो गए, these are called the Kupffer cells, and they are very important in the process of phagocytosis, ताकि ये blood को clean कर सकें. The endothelial lining of the sinusoids has extremely large pores, and this is a speciality of the liver sinusoids. They have big pores, some of which are as big as 1 micrometer in diameter. And beneath this lining, lying between the endothelial cell and the hepatic cell, is a space called space of Day's, which is also known as perisinusoidal space. So if you look at this diagram, these are probably the endothelial cells, and alongside, so these ones are endothelial cells, these are hepatic cells, so इनके बीच में फिर space है ना, ये white वाली space, this is called the space of Day's. Okay, तो आपको exactly clear पता होना चाहिए कि हम किस area की बात कर रहे हैं. And there will be millions of spaces of Day's. They connect with the lymphatic vessels in the interlobular septa. Therefore, excess fluid in these spaces is removed through the lymphatics. Because of the large pores in the endothelium, substances in the plasma move freely into the space of Day's. So यहाँ space of Day's की एक तरफ endothelium है ना, so there is a lot of to and fro movement between the plasma and the space of Day's. Okay. Hepatic vascular and lymph system, the function of the hepatic, so this is elsewhere पूरी anatomy detail में हमने इन्होंने यहाँ chapter 15 में भी इसका जिक्र किया, but we have also done it in the anatomy lectures. Okay, so quickly यहाँ जो बातें discuss करनी है जो physiologically important है, that includes blood flows through the liver from the portal vein and the hepatic artery. So these are two important vascular systems in the liver that you have to understand. Liver has a very high blood flow and low vascular resistance. यानी blood काफी ज़्यादा गुजरता है liver में से, और चूंकि ज़्यादा blood गुजरता है, understandably उसकी जो vascular resistance है वो कम होगी. Because अगर vascular resistance ज़्यादा होगी तो blood गुजरेगा ही नहीं ज़्यादा, है ना? About more than a liter of blood per minute flows from the portal vein into the liver sinusoid. An additional 300 milliliters per minute flow into the sinusoids from the hepatic artery. So that's a total of like 1300 milliliters, about 1.5 liters, okay, which is about 27% of the cardiac output. So if you look at the diagram here, remember these two names. We are talking about the portal vein, this is number 1, and number 2 is the hepatic artery. So try to locate these structures here. We have a portal vein and we have a hepatic artery. So hepatic artery is going to supply the oxygenated blood, and the portal vein is going to supply the blood from the GI tract. So ज़्यादा blood GI tract से आ रहा है और कम blood आ रहा है. It's about 1 liter per minute from the GI tract and about 0.3 liter per minute from the hepatic artery. The pressure in the portal vein leading into the liver averages about 9 millimeters of mercury, and the pressure in the hepatic vein leading from the liver into the vena cava is about 0 millimeters of mercury. So remember this pressure difference, it's important. This small pressure difference of about 9 millimeters shows the resistance to the blood flow through the hepatic sinusoid is very, very low. So almost no resistance. Therefore, blood goes very, very rapidly through the sinusoids. Okay. Now, cirrhosis of the liver greatly increases the resistance. Now, this is understandably a very easy concept because, see, if this is the liver, I mean, imagine liver as an organ और यहाँ से एक blood supply आ रही है और यहाँ से blood वापस जाना है. So, blood has to go, say, for example, in this direction. And the liver is such a nice structure. But if this becomes fibrotic, then the all channels are all distorted and all channels are disturbed. And as a result of this, now the blood will not be flowing in this direction because there will be increased resistance. Okay. So, if there is increased resistance within the liver, then there will be a problem in flowing of the blood. Okay, so if there is cirrhosis, the resistance to blood flow increases. When liver parenchymal cells are destroyed and replaced by the fibrotic tissue, and this is what happens in cirrhosis, they are replaced by the fibrotic tissue. This disease process is known as cirrhosis of the liver. It results most commonly from cirrhotic alcoholism. Alcohol एक इसके cause है, then NASH है, even malnutrition might happen, and NAFLD. These are all the diseases which lead to cirrhosis of the liver. They are very commonly linked with cirrhosis. Cirrhosis can follow ingestion of poisons as well, such as carbon tetrachloride, some viral diseases such as hepatitis B virus infection, hepatitis C virus infection. The portal system is also occasionally blocked because there is everywhere cirrhosis, so there is everywhere fibrosis. So because of fibrosis, the channels are blocked, okay? And this may also lead to portal hypertension, which we have done in detail in pathology. Now, liver also stores the blood. Because liver is an expandable organ, large quantities of blood can be stored in the blood vessels within the liver. Its normal blood volume, including that in the hepatic vein and the hepatic sinuses, is about 0.5 liters, 450 ml, which is about 10% of the body. So remember, liver can give a good amount of blood when needed. It's a good storehouse, okay? Liver has a very high lymph flow. Because the pores in the hepatic sinusoid, यहाँ पे pores हैं, so there is a large molecules enter into the space of this, and then they have to be removed. Therefore, a very efficient lymphatic system is required. So liver has a very good lymphatic system. These are all the general principles that you have to remember about liver. High hepatic vascular pressure can cause fluid transudation into abdominal cavity from the liver and portal capillaries. The term known as ascites, a very important concept, okay? So let's go through this very quickly. When the pressure in the hepatic veins rises only a little, 3 to 7 millimeters above normal, excessive amount of fluid begins to transudate. Obviously, एक vessel में जब pressure बढ़ेगा, तो there will be exudation, right? Transudation will happen into the lymph and the leak through the outer surface of the liver capsule directly into the abdominal cavity, and so this is kind of edema of the abdominal cavity, and the abdominal cavity expands filled with the fluid. This fluid is almost as pure as plasma, because this is just filtration, containing 80% to 90% as much protein as normal plasma would contain. At the vena cava pressure of 10 to 15 millimeters of mercury, hepatic lymph flow increases as much as 20 times, and the swelling from the surface of the liver, because the liver is leaking out plasma, it becomes huge, and the increase in the size of the abdominal cavity because of the filled fluid is termed as ascites, okay? Now, regeneration of the liver is an interesting concept. Liver possesses a remarkable ability to restore itself after significant hepatic tissue loss from either partial hepatectomy because of any acute liver injury or anything else. Partial hepatectomy, in which up to 70% of the liver is removed, causes remaining lobes to enlarge and do the job. So there is a good considerable capacity of regeneration. During liver regeneration, hepatocytes are estimated to replicate once or twice, and after the original size and volume of the liver is attained, then the replicative process stops. Control of this rapid regeneration of liver is not very well understood, but there are some factors which help the process of regeneration in the liver, and these factors include, for example, hepatocyte growth factor. You need to remember this one at least, okay? After the liver has returned to its original size, the process of hepatic cell division is terminated. Again, the factors involved are not very well understood, although TGF-beta, transforming growth factor beta, which is also secreted by the hepatic cells, is potent inhibitor of proliferation. So it is believed that when the cells are regenerating, there is increased production of hepatocyte growth factor, and once the original size or near original size is attained, there is increased expression of transforming growth factor beta. It stops regeneration, okay? Now, the hepatic macrophage system, it is an important system which serves as a blood cleaning cleansing function. So blood flows through the intestinal capillaries, picks up many bacteria, क्योंकि जो आप खाना खा रहे हैं उसमें बहुत सारा बैक्टीरिया मौजूद है. So intestine से portal supply के through जो blood liver तक पहुंचता है, it contains a lot of bacteria. Okay, and therefore we have in the liver specialized macrophages called Kupffer cells. They engulf those bacteria. So this is very nice arrangement. When the blood comes in there, there are these Kupffer cells sitting in there, and they clean the blood. So cleansing, मैं आपसे कह रहा था ना, purification is the job. So that is how purification happens. Now, when we talk about the metabolic functions, there are so many. So carbohydrate, protein, lipids, all these things किसी न किसी एंगल पर इनका मेटाबॉलिज्म एसोसिएटेड है लिवर के साथ. Liver is a large chemically reactant pool of cells, the very chemically active cells that have a high rate of metabolism. These cells share substrate and energy from one metabolic system to another, process and synthesize multiple substances which are transported back and forth in the blood. For these reasons, a major share of entire disciplinary biochemistry is actually devoted to the metabolism in the liver. So you deal with this in great detail when you do biochemistry. So यहाँ हम quickly जो main points हैं उनको touch करेंगे. Okay, for example, with respect to carbohydrate metabolism, liver performs many functions such as storage of glycogen, such as conversion of galactose into fructose and glucose, gluconeogenesis, formation of new glucose, and formation of many chemical compounds from intermediate products of the carbohydrate metabolism. So we produce a lot of different intermediates in metabolizing carbohydrates. Glycolytic pathway में और TCA के pathway में काफ़ी सारे intermediates बनते हैं. लिवर में आकर वो बहुत सारी और चीज़ों में कन्वर्ट हो जाते हैं. सो वेरी इंपॉर्टेंट with respect to carbohydrate metabolism. The liver is especially important for maintaining a normal blood glucose. Very important point कि आपकी बॉडी में नॉर्मल ब्लड ग्लूकोज कॉन्सेंट्रेशन मेंटेन करने का मेन जिम्मा लिवर ही का है. स्टोरेज ऑफ ग्लाइकोजन अलाउज द लिवर टू रिमूव एक्सेस ग्लूकोज फ्रॉम द, यानी जब आप बहुत ज़्यादा मीठी चीज़ें या कार्बोहाइड्रेट वाली डाइट खा लेते हैं तो ये आपका लिवर ही है जो इस एक्सेस ग्लूकोज को एज ए ग्लाइकोजन स्टोर करता है, और जब बॉडी को चाहिए होता है तो इस ग्लाइकोजन में से ग्लूकोज निकाल के दे देता है. Okay, this is called the glucose buffer action. Whenever needed, it releases glucose in the blood. Whenever not needed, it stores glycogen in the liver. Gluconeogenesis in the liver is also an important phenomena where we make new glucose molecules from non-carbohydrate sources. Liver is also heavily involved in fat metabolism. Although most cells of the body metabolize fat, certain aspects of fat metabolism occur mainly in the liver, or I would say only in the liver. In fat metabolism, liver performs the following: oxidation of fatty acid, and it supplies energy, synthesis of large quantities of cholesterol, phospholipids, and lipoproteins. And these are very important molecules because cholesterol is then needed for making a lot of different chemicals. Phospholipid is an important component of our cell membranes. And then liver is also involved in synthesis of fat from proteins and carbohydrates. So फैट सिंथेसिस, फैट की कंजप्शन, सारी चीज़ें लिवर में हो रही हैं. To drive energy from neutral fats, the fat is split into glycerol and fatty acid. That's the normal metabolism. The fatty acids are then split by the beta oxidation into two carbon acetyl radicals that form acetyl-CoA, and it then enters into the citric acid cycle to give you NADH, which later on gives you ATP. The liver cannot use all the acetyl-CoA that is formed. Instead, it is converted by a condensation of two molecules of acetyl-CoA into acetoacetic acid. Highly soluble acid that passes from the hepatic cells into the ECF, and then it is transported through the body to be absorbed by other tissues. So liver is not only producing acetyl-CoA and it can use it for energy, but it is also generating acetoacetic acid which gets out in the blood, and other tissues can use it as a source of energy. और वो टिश्यू reconvert करते हैं acetoacetic acid को into acetyl-CoA, and then acetyl-CoA enters into the TCA cycle. You getting my point? About 80% of the cholesterol synthesized in the liver is converted into bile salts, which are secreted into the bile, and the remainder is transported in the lipoproteins and carried by the blood to the tissues which require them. Phospholipids are likewise synthesized by the liver. Almost all the fat synthesis in the body from carbohydrate and protein also happens in the liver. So liver, main machinery है. अगर हम बात करते हैं प्रोटीन मेटाबॉलिज्म की, so the body cannot dispense the liver's contribution to protein metabolism as well. It is involved in deamination of amino acid, formation of urea, very very important, because otherwise you will not be able to handle ammonia, which is very toxic. So you convert it into urea in the liver, and then you excrete it out of the kidneys. Formation of plasma proteins. फिब्रिनोजिन की बात कर लें, ग्लोबुलिन्स की बात कर लें, एल्बुमिन की बात कर लें. लिवर इज़ द साइट जहाँ पे ये सारी प्रोटीन्स बनती हैं. इंटरकन्वर्जन्स ऑफ वेरियस अमीनो एसिड्स, एक अमीनो एसिड से दूसरा अमीनो एसिड बनाना, ऑल हैपन्स इन द लिवर. सो लिवर इज़ टिपिकली वेरी वेरी इंपॉर्टेंट. ओके, और कुछ इसमें से फंक्शन तो क्लिनिकली, कुछ क्या सारे ही फंक्शन क्लिनिकली सुपर इंपॉर्टेंट है. यूरिया की अगर हम बात कर लें, सो इफ़ द लिवर इज सिरोसिस अगर किसी को फॉर एग्जाम्पल, सो लिवर इज़ नॉट एबल टू कन्वर्ट ammonia into urea, so levels of ammonia go high and the person goes into hepatic coma. So cirrhosis mein hepatic coma is very very common phenomena. So इसी तरह अगर किसी में से फॉर एग्जांपल फिब्रिनोजिन नहीं बन रहा या एल्बुमिन नहीं बन रहा, then there will be generalized edema if there is no albumin. If there is fibrinogen not available, then there will be problems with clotting. So very important. Liver का function cannot be ignored in all macromolecule metabolism, चाहे वो carbohydrate हो, proteins हो या fats हो. Okay, and then there are so many other functions of liver. So for example, liver is a storage site for many vitamins. The liver has a particular propensity for storing vitamins and has long been known as an excellent source for certain vitamins. For example, it stores great quantities of vitamin A, but large quantities of vitamin D and B12 are normally stored as well. So remember, these are all the vitamins stored in the liver. It also stores iron in the form of ferritin. Except for the iron in the hemoglobin of the blood, by far the greatest proportion of iron in the body is stored in the liver. That's the only thing that you need to remember. The hepatic cells contain large amount of protein which are called apoferritin, which is capable of combining reversibly with iron. यानी जब iron चाहिए होगा उसको release भी कर देगा. Therefore, when iron is available in the body in large quantities, it combines with apoferritin and it forms ferritin. So ferritin is basically apoferritin plus iron. So this combination is called ferritin. Okay, stored form of iron in the body. Liver forms substances used in blood coagulation. So coagulation proteins, very important. Substances formed in the liver that are used in coagulation include a lot of clotting factors. Fibrinogen, prothrombin, factor 8, all of them. And you can imagine without them what would happen to clotting profile. Then liver is also important in removing certain drugs and hormones. The liver is well known for its ability to detoxify and excrete a lot of chemicals. Famous one being sulfonamide, erythromycin, ampicillin. So bile में उनको निकाल देता है, excretion का function. Measurement of bilirubin in the bile as clinical diagnostic tool, very important. Jaundice वगैरह में use करते हैं. Formation of bile by the liver and the function of bile salts in the digestive and absorptive capacity have long been utilized in diagnostic procedures. In addition, many substances are excreted in the bile. One of these substances is the greenish yellow pigment bilirubin. And bilirubin conjugated है या unconjugated है, उससे jaundice कितना हो रहा है, that has all been very much used in identifying jaundice. So मैं jaundice की details में भी नहीं जा रहा, but you know that this is an important clinical indicator for liver function. Or bilirubin formation and excretion is not the topic here, but the whole point is that we get our red blood cells which are taken up by the reticuloendothelial system, probably in the spleen. We get heme out, and then heme is converted into biliverdin, and then unconjugated bilirubin, which in liver is then conjugated, and part of this is excreted in the feces, part of this is excreted in the kidneys. So bilirubin ke levels high hona is what we call jaundice. If it is conjugated bilirubin high, it's a separate story. If it's unconjugated high, it's a separate story. We'll deal this with in jaundice lectures. But remember, liver K products are used very well in the diagnostic algorithms. And then formation and fate of urobilinogen. It's once in the intestine, about half of the conjugated bilirubin is converted into urobilinogen, which is highly soluble, and it basically ultimately converts into stercobilin by bacteria, and this is what is responsible for the brown coloration of the feces. Jaundice पे मैंने आपको बताया कि we will have a separate lecture completely. So jaundice basically refers to the yellowish tint in the body tissue, and this is because of the high quantities of bilirubin, and it can be unconjugated bilirubin or conjugated bilirubin. Different causes. If there is more hemolysis, it may lead to unconjugated. If there is liver problems, then unconjugated may be high. So depending upon what the cause is. I'm not going into the details of jaundice at the moment because we will have a separate video for jaundice later on. Hemolytic jaundice is caused by hemolysis of the red blood cells. So since the whole bilirubin physiology is basically starting from breakdown of the red blood cell, if there is more hemolysis because of any reason, if there is hemolytic anemia of any cause, there will be more and more rupturing of the red blood cell and more bilirubin formation. So more and more jaundice. Okay. Then there is a terminology called obstructive jaundice. Now, obstructive jaundice का मतलब ये है कि the liver machinery is okay, there is no excessive hemolysis, but say for example bile duct जो बाहर आ रही है इसमें stone है, इस stone की वजह से there is backflow of bilirubin which increases in the blood because it's not being excreted in the GI tract. So इस तरह का अगर phenomena है, this is called obstructive jaundice. It can be because of stones, it can be because of tumors of the bile duct or neighboring tumors, say for example in the pancreas head, which will all obstruct the outflow of bile from the liver into the intestine. Obstructive jaundice, okay? Now, diagnostic difference between hemolytic and obstructive jaundice. Again, मैंने आपसे कहा कि it's a separate topic, but anyways, very quickly, chemical laboratory test can be used to differentiate between the two forms. Remember, hemolytic jaundice में it's increased hemolysis which is causing increased bilirubin, and obstructive jaundice में it is the obstruction and not the hemolytic problem. Okay, in hemolytic jaundice what would happen कि there will be unconjugated bilirubin which will be very high, जबकि obstructive jaundice में चूंकि liver ने अपना काम कर दिया है, conjugation हो गई है, तो जो backflow होगा that will be that of the conjugated bilirubin. But anyways, ये ज़्यादा अच्छा समझ में आएगा जब हम इसको अलग से as a topic jaundice को discuss करेंगे. Okay, but I'm sure कि in this video I was able to give you the basic idea कि how important liver is in terms of your physiological orchestration of different body functions. So I hope you liked the video. If you did, please share it with your colleagues, subscribe the channel. My name is Professor Asif Qureshi and you are watching Dr. Asif Lectures.